We're now joined by Linda Smith, who is director of the Early Childhood Initiative at the Bipartisan Policy Center. Linda, great to have you with us.
Well, thank you for having me. I appreciate it.
You got to describe what the center is.
Well, we're a Washington, D.C. based think tank that tries to take ideas from both sides of the aisle to create better policies for some of the most pressing issues in America. And obviously, childcare is one of them. Yeah,
you mentioned childcare. We have been engaged. People, I'm sure, are tired of hearing me say this, but we have a series called Reimagine Childcare. We're constantly looking to try to understand childcare challenges. But from your perspective, what is the direct connection between the need for affordable, accessible, quality childcare and the economic vitality of our nation?
Well, I think it goes without saying that, America can't work without childcare. I mean, it really is that simple. And so for parents to be active, productive members of our economy, they need to have their children cared for. And in a way that, makes them feel good about it. They can't be at work worried about what's happening with their children while they're not there.
Mm. The center has looked at, examined, studied, tried to make sense of the military's childhood system. What is it, and why is that a model for us to better understand?
Well, I think the military system is a model for several reasons, actually. First of all, it is a business model. I mean, the military does childcare because they need childcare for mission readiness. In other words, you're not going to the front lines if you don't have childcare. So they early on recognized the importance of childcare when it came to the basic business of the Defense Department. I think that the other thing that's important about the military's model that is missed by a lot of people is the way the military actually funds childcare. I think perception number one is that parents don't pay for it in the military, and they do. The other piece, though, is that the government, through the DoD, through the government funds, basically matches on a dollar for dollar basis what parents pay. So parent fees are matched dollar for dollar, but the way the money goes into the program is what makes it different and makes it successful. And the way it goes into the program is the money goes directly to the programs to buy down the cost of care for parents.
Well, can that model, the military model, can and how it be used as a model across the nation?
Well, I think it really can, and it needs to be, because I think one of the things that we just learned in COVID was that we have a very fragile supply of childcare in this country. When COVID hit and the programs closed, they closed because they didn't have any income. They were very unstable. We've lost what we think is at least 10% of our supply over the last couple of years, and it's going to be hard to get that back. So the reason that the military model is what the nation needs to think about is that we need a system where we support these programs, keep them viable as businesses, but at the same time allow parents choice. And so what you see going on right now in our country is a lot of conversation about giving parents more access, giving parents certificates, vouchers, whatever you want to call them, to go out and buy care. But without the care, the supply being addressed, we're not solving the problem. Where do you take that voucher if we don't have enough childcare providers out there?
And we've had so many. By the way, check out our website at steveadubato.org. You'll see on the screen so many interviews that we've done so many interviews and segments about the fact that it's so difficult to find quality childcare professionals to be with those children, which then in turn closes childcare centers down, which even if they're open, limits the number of childcare classrooms or the number of children that can be taken care of. It's this vicious cycle. Let me ask you something, Linda. How do we avoid, and again, our job is not to be advocates, but rather to be engaged in public awareness, but how do we avoid the messaging or the message that, this childcare thing, it's a nice thing to do, but it's sort of like daycare. And we've had enough of these social spending programs, and we need to cut down on that. We need to cut spending on them. We need to be more fiscally prudent. And it's a nice thing to do, but it's not a necessary thing to do. I'm just saying some people think that. What is the appropriate retort to that?
Well, I think it's multiple. I mean, and we just talked a little bit about the issue of parents can't go to work without childcare, but I think the science has been crystal clear now for about 20 or 30 years on the science and the neuroscience, the brain development. And we really do know now that the first 3 years are very critical to a child's later success in life. So it's not just that parents need it to go to work. We need quality childcare because of our education system. We're feeding kids into our schools who aren't ready for that because they're coming out of experiences that haven't prepared them for it. We have health issues. I mean, it's like there's so many aspects of childcare that it's just not one dimensional. And I think the payback for investing in childcare goes without saying. The economic impact studies have been done, the ROI, the return on investment, that's all been done. We know these things, we just need to act on them now.
Before I let you go, the biggest impact of COVID as we do this program at the end of 2021, seen a little bit later, biggest impact of COVID on childcare overall?
Well, I think it's been on the workforce because when COVID hit, the workforce was just simply laid off. There was no money to pay them. The income to the program stopped. And we have a workforce that was already in trouble. I think, we know that the average wage of childcare workers is $12 an hour in this country. You can make a lot more than that going down the street to a fast food restaurant in this country. So what is the incentive? And I want to stress that the workforce issues are real. You started out saying that they were having trouble recruiting staff. Well, half of the childcare workforce in this country qualifies for public assistance programs. That said, half of the workforce also have degrees of some sort, whether an AA or a BA. So it's not an underqualified staff, it's an underpaid staff. And that's because parents can't pay anymore. So we have really got to fix this.
Linda Smith, the director of the Early Childhood Initiative at the Bipartisan Policy Center based in Washington, D.C. Linda, we thank you for joining us, educating us, and helping us better understand. Thank you, Linda.
Thank you.
We'll be right back after this.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. Funding has been provided by Hackensack Meridian Health, the Turrell Fund, supporting Reimagine Childcare, PNC, Grow Up Great, NJM Insurance Group, the New Jersey Education Association, the New Jersey Board of Public Utilities Clean Energy Program, the Northward Center, the Russell Berry Foundation, and by NJ Best, New Jersey's 529 College Savings Plan. Promotional support provided by Jaffe Communications and by Insider NJ.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.